Overdiagnosis isn't a mistake, it's a direction. Modern medicine doesn't just treat illness anymore, it expands the definition of it. Thresholds get lowered, normal becomes borderline, borderline becomes needs intervention, and just like that, millions of healthy people are reclassified as patients. Not because they're dying, because they fall slightly outside a moving line, and that line moves a lot. Blood pressure, cholesterol, anxiety, attention, sleep, mood, every category keeps widening. More labels, more conditions, more lifelong management. Because management is profitable. Cure something once, you get paid once. Manage it forever, you get paid forever. So what happens? You go in for one issue and walk out with 3 diagnoses and 2 prescriptions, maybe more. Each one justified, each one backed by a guideline, each one technically correct. But step back and look at the pattern. Are people actually getting sicker that fast? Or are we getting better at labeling normal human experiences as medical problems? Stress becomes a disorder. Grief becomes a condition. Distraction becomes a diagnosis. Being tired becomes a deficiency. And now you need something for it. Then comes overmedication. One pill leads to a side effect. That side effect gets another pill. That pill creates another issue. Now you're managing the management. Polypharmacy. Stacks of prescriptions that interact in ways no one fully tracks long term, and people trust it because it feels official, controlled, clinical. But the human body isn't a checklist, it's a system. You don't fix a system by isolating symptoms and throwing chemicals at each one independently. You create imbalance. Then you treat the imbalance. Then you repeat. Meanwhile, the root causes sit untouched. Diet, movement, sleep, environment, chronic stress. These don't come in a bottle, so they don't scale the same way. They're harder, slower, less profitable. So they get lip service instead of priority. And to be clear, medicine saves lives. Emergency care, infections, surgery. When it matters, it matters. But that's not where most people live. Most people live in the gray area. Long-term conditions, preventable decline, subtle dysfunction that turns into permanent dependency. That's where overdiagnosis and overmedication thrive. Not in crisis, but in maintenance. And the system is built to keep you there. Because a patient who needs constant monitoring, constant prescriptions, constant adjustments, that's not a failure of the system. That's a customer.
Tiny red dot on the screen feels like an eye on my teeth when I speak.